Hello and welcome to Meet the Author. I'm Louis Meyers, and it is the greatest honor today to have as our guest Dr. Anthony Fauci, who's with us from Washington, D.C. via Zoom. I think Dr. Fauci probably needs no introduction to the general audience, but I'm going to go over some of the highlights anyway as we talk, and we'll be talking about his book, On Call, which was published last year. It is a tremendous memoir, just wonderfully written. And I would recommend it to everybody, both in and out of medicine. It's really the history of public health for the last 50 years or so in the United States, and of course, the history of Dr. Fauci's life. Dr. Fauci was born and raised in Brooklyn, New York. He got his MD medical degree from Cornell University, where he graduated first in his class. He did his medical residency and a chief residency at the Cornell Associated Hospitals in New York City. In 1968, he joined the Public Health Service and spent the remainder of his career at the NIH in Bethesda, Maryland. In 1982, he became the youngest ever director of the National Institute of Allergy and Infectious Disease, and he retired in 2024 as a Rear Admiral from the Public Health Service. So I guess we could call you, also address you as Admiral Fauci. He has received the Presidential Medal of Freedom from President George W. Bush, and in fact has worked with numerous presidents, and we'll talk about each of them, I hope, in this hour. He has been involved with all of the major health crises that have affected this country over the last 40 to 50 years. So again, it is a great honor to have you. Thank you for being here.
My pleasure. Good to be with you.
I thought we would start where the book really begins, in Brooklyn, New York, with your family. And you write fairly extensively about the influence they had on you. And I might quote one paragraph, if I may, from the book. You say, "People often ask physicians what motivated them to go into the field of medicine. Like so many others, I am sure my reasons are complex, but without engaging in too much self-psychoanalysis, it seems clear to me that growing up in a household where both parents were strongly motivated to care for others had a profound influence on my career choice." Can you tell us a little bit about your family and what those years in Brooklyn were like?
Yeah, my father was a pharmacist who ran a mom and pop type pharmacy in a working class section of Brooklyn, New York. And I mention that because unlike the industrial pharmacies of today, the CVS's and the Walgreens, his pharmacy served as the neighborhood hub of being a combination of person who not only fills prescriptions, but is sort of the neighborhood psychiatrist, marriage counselor, and comforter of parents who had delinquent children. And in my neighborhood in Brooklyn, that was not an uncommon phenomenon. So rather than being a businessman, which he was not a very good businessman, in that often people of poorer means in the neighborhood could not afford prescriptions, he would put it on a tab for them. And not infrequently, they wound up not being able to pay. So it wasn't a very profitable enterprise, the pharmacy. But the thing that it was really a hub of public service to the community. And I helped out in the store and delivered prescriptions on my Schwinn bicycle around the neighborhood from the time I was, 8, 9, 10 years old. And as I've said in the memoir, the idea of public service without necessarily any major financial remuneration kind of became part of my DNA from the time that I was a child. So that was very important to me. I mean, it was subconscious at the time. I wasn't thinking as an 8, 9, 10, 11-year-old that this might be one of the deciding factors that put me in the direction of a field of medicine that actually was dedicated to the service to others. And this was amplified and complemented by my educational trajectory that followed. For example, I went to a Jesuit high school in Manhattan, Regis High School, and then I went to a Jesuit college in Massachusetts, Holy Cross College. Both of those institutions had the motto of the school, service for others. So it was sort of a continuum of what I learned as a child, helping out in my mother and father's pharmacy up through and including my college education. So that to me was really the pathway to my becoming a physician, and particularly a physician in the public health service, which was very clearly devoted towards service to the general community.
And indeed, your next step was medical school at Cornell, where I mentioned you were number one in your class. Now, I went to medical school also, and I was not number one in my class. I think it's fair to say that most people who go through medical school are reasonably intelligent, hardworking, and diligent, but to be first in the class requires an extra quotient of all of those. What was it about medical school that you enjoyed?
Well, I thoroughly enjoyed the steepness of the learning curve. I mean, obviously, all of us who've gone through medical school, it's not an easy, light journey. You have to put in a lot of hours and a lot of time and a lot of study. But the beauty of it was that the learning curve was so steep. Every day, every week, every month, you learned something new with the background thought in mind that all of it one day would contribute to your being a physician, which was the whole goal, obviously, of going to medical school. So I thoroughly enjoyed it. I know when you say that to people who are in medical school now, they raise their eyebrows and say, "What are you talking about? It was really hard work." But it was a special kind of hard work because you had the gratification of learning every single day something that you knew was going to directly or indirectly be important for you later on in your career.
I think it's fair to say you have been a lifelong learner. You did say in the book, and I quote, "My years of internship and residency, which come after medical school, were where I truly found myself. I felt as if I were doing what I was born to do." What in those years of residency, middle of the night call, as you on call, what was that like for you?
Well, it was very exciting, very gratifying, very challenging. You train for something so that you can ultimately do what physicians do: alleviate suffering, prevent disease, treat disease, and hopefully prevent unnecessary premature death with people that have different diseases. I enjoyed very much the acuteness of hospital medicine, the fact that what you were dealing with had serious consequences. And if you did it right, you might save someone from suffering, or you might even save a life. And you always wanted to make sure that you were giving it your absolute best, because the responsibility for the life, health, and welfare of another human being is a sacred thing. And I looked upon it like that. So it was challenging, it was exhausting, but I loved it.
And you came of age when there weren't limited hours for residents. You could be on call almost constantly through those 3 years, 4 years for chief residency. So it was a different era as well. Now, 1968, Vietnam War was raging. You joined the Public Health Service and moved from New York down to Bethesda, Maryland, or the D.C. area, to join the Public Health Service and the NIH, where you would spend the rest of your career. What was that like at that point at NIH when you first got there?
Well, it was actually transformative to me because my initial goal was to finish my residency, including my chief residency, take a fellowship, which I did, in infectious diseases and clinical immunology at the NIH with the full intention of going back to New York City and practicing medicine on a daily basis out of a teaching hospital, namely the New York Hospital Cornell Medical Center. In fact, I was very specific. I knew exactly what I wanted to do. I wanted to have an office somewhere around 69th or 70th Street and York or First
Yeah,
Avenue
that is very
and
specific.
practice medicine. But going to the NIH changed everything for me because I became exposed to the discipline of basic and clinical research, where you could have a multiplier effect if you made an observation, either in a clinical trial or in a basic research observation, that could benefit a wider group of patients that you might not ever see personally and take care of, namely, develop clinical protocols for different diseases or make a basic science observation. So, my thoughts about just being completely in clinical practice changed. And that's when I decided that I was going to continue to be a clinician. I never wanted to give that up, and I still have not given that up. But I wanted to do it in a research setting. And that's the reason why, after I finished my chief residency in New York in 1972, I came back to the NIH as a senior investigator at the National Institute of Allergy and Infectious Diseases. So my going to the NIH actually pivoted and changed the direction of where I thought I was going to go with my career. I thought I was going to be purely a clinical doc, and it turned out I got into research, and then from there, a number of things unfolded, including my becoming the director of the Institute and getting involved in public and global health issues.
One of the other lovely things that unfolded, of course, was you met your wife, Christine, and would eventually have three daughters. So that was all took place in those years as well. And we should say it's rarefied air at the NIH. Some of the highest quality research in the country, and some of the very sickest patients who come there, because often there are no other options for them, and they have chosen bravely to be in these research protocols. So it's a quite a special place. So the 70s go on, and then 1982, I believe, you become as I mentioned, the youngest director of the NIAID. And 1982, 1983, a new development, a new crisis in medicine begins to develop, and you were there at the onset, and that's, of course, HIV/AIDS. Tell us about how you first knew that this was serious matter that was beginning, and what were your reactions at the time?
Yeah, I think that was, I don't think it's clear that that was another major pivotal point in the arc of my career, because from 1972 to 1981, while I was at the NIH, I was fortunate enough to be involved in the development of certain clinical therapeutic protocols for autoinflammatory diseases, the vasculitides, Wegener's granulomatosis, which we now refer to as granulomatosis with polyarteritis nodosa, a formerly fatal disease. I developed with my mentor a therapeutic approach using low doses of drugs that formerly were used for cancer, such as cyclophosphamide. And we took a disease that was literally 100% fatal and put a 93% remission rate. So things were going very well for me for 1972 to 1981. But then in 1981, I describe it in my memoir. I was sitting at my desk at the NIH, and the Morbidity and Mortality Weekly Report, which is the weekly epidemiological report from the CDC, landed on my desk, reporting 5 curiously all gay men from Los Angeles who presented with an unusual pneumonia, pneumocystis pneumonia. I thought it was a fluke. I really, to be quite honest and transparent, I thought it was something that was a one-off and that would no longer hear anything more about it. And then a month later, in July of 1981, another MMWR report came out, this time of 26, curiously, more than curiously, fantastically, all young gay men, not only from Los Angeles, but from San Francisco and New York City, who presented not only with pneumocystis pneumonia, but with a variety of opportunistic infections, including Kaposi sarcoma. And it was at that point in the summer of 1981 that I decided, against the advice of my mentors, that I would yet again change the trajectory of my career and devote myself completely to studying this brand new mysterious disease, which at the time did not even have a name. We were calling it things like GRID, or gay-related immunodeficiency. It certainly didn't have an etiologic agent, because that wasn't discovered until 1983, 1984. So I began admitting, caring for, and trying to study these desperately ill, mostly young gay men. And I did that from 1981 right up until the time that I left the NIH, because AIDS really was the major foundation of my research and my clinical career. But again, that was a very important time in the summer of 1981, because from that time on until we developed therapies, that was really the dark years of my medical career, because we had nothing to offer these patients. I mean, we didn't even know what the agent was, and it took us several years thereafter to develop the first drug, and a good 10 years or more to develop a really effective therapeutic regimen. So it was a very interesting experience of dealing with a disease that was virtually killing everyone, and yet to be present when new and important drugs were being developed.
You really became, in many ways, the face and the focal point of research and treatment into AIDS. Of course, there were a lot of other people working on it, but you became the focus of not only positive news, but also, as you know, a lot of activism by particularly gay people who were dying in great numbers and were terribly frightened and frustrated and despairing. And a number of people joined in a group called ACT UP, was one of the prominent ones, which pushed for faster development and faster approval of drugs, with the first one being, as you mentioned, AZT, which was successful, effective for short periods of time, but usually not long periods of time. And they sort of focused their anger on you. And tell us, what was that like? Here you were trying your best to go in every day and every night, I assume, trying to take care of these patients and find a cure, and yet you were being vilified.
Well, they had a good reason to be upset with the federal government. I was one of the few people, because I was at the NIH. I was directing the AIDS program in the early years, in the early to mid 1980s. And the gay community understandably felt that the federal government was not putting enough resources into HIV/AIDS. And there was another issue, that the clinical trial designs were very rigid with inclusion and exclusion criteria. And the FDA and the regulatory approach towards the approval or not of experimental drugs was understandably quite rigid. The gay community felt that, given the bleakness of the prognosis of the disease that they and their colleagues and loved ones had, that the slow pace of the approval process and the ability to have compassionate availability of drugs was not actually well suited to this unusual disease of HIV, which was killing people within 12 to 15 months of the onset of symptoms. So they wanted to push back on the federal government, say, we want to have a say in how trials are designed, and we want to have a say about the rigidity of the regulatory process, namely the FDA. The scientific community, understandably, but retrospectively inappropriately, were saying, we know what's best for you. We've done this for decades. It's worked well. We have safeguarded the safety of the American public with new drugs. So we'll continue what we're doing. They would have nothing of it. So they began to push back. Since I was a visible person in the AIDS effort, and I was working as a member of the federal government, I was an NIH employee, I became, as you mentioned, Dr. Meyers, the target of the AIDS activists. And they began demonstrating against me personally, like, we need more flexibility, we need more money. They became very demonstrative, iconoclastic, disruptive, theatrical. And one of the best things that I believe I've done in my career, my professional career, was instead of pulling back from them the way most of the scientific community was doing, they were very intimidated by the disruptive behavior of the activist. I said to myself, let me put aside the theatrics and the disruption, and let me listen to what they were saying. And when I listened to what they were saying, they were making absolutely perfect sense. And I said to myself, if I were in their shoes, I would be doing exactly what they were doing. And that's when I embraced the activist community. And from that time on, as the months and years went by, the relationship between the advocacy community and the scientific community got better and better, and it became a productive endeavor instead of a disruptive endeavor. That was the beginning of real advocacy in biomedical research. It really got its foundation in the early years of HIV.
And that has spread through a number of different disorders now, many of which seem to have their own advocacy organizations. You, in fact, became close friends with some of the leading activists, Larry King in particular, a playwright, and who eventually passed on. You also lost some very dear friends in the scientific community and otherwise to AIDS. And you saw a lot of young, otherwise healthy people die. And I just wonder if there's such a thing as PTSD in medicine, if you ever experienced anything like that.
Oh, definitely. I actually even write about it. I'm glad you asked. Yeah, I mean, during the early years when I was personally responsible for taking care of significant numbers of, again, young, almost exclusively gay men who had previously been healthy, who come in with a terrible disease of which we can do very little, sort of like putting Band-Aids on hemorrhages. When you do that for a couple of years in a row, more than a couple, a few years in a row, in order to deal with it, you've got to suppress a lot of the pain associated with seeing all of these young people suffering and dying, and the frustration of not being able to do very much for them but comfort them. That has a big toll on you. And even now, I have flashbacks of what I, interpreted as a form of post-traumatic stress. When I reflect back on times when I was on the ward at 10, 11 o'clock at night, and one patient after the other was on the verge of dying because they were so seriously ill. And you don't have really early on in the mid 80s and early 90s, we didn't have adequate therapy. Now, today, 2025, we have phenomenal drugs that a person can take one pill once a day or an injection every 2 months and suppress the virus to below detectable level. We didn't have that back then. So the answer to your question is yes. I still get an occasional twinge of post-traumatic stress when I think about those years.
President Reagan, of course, was president from 1980 to 1988. And as we know, he had some difficulty in publicly addressing the issue of AIDS. I did interview several months ago Ms. Karen Tumulty, who's the chief political correspondent for the Washington Post and has written a very good biography of Nancy Reagan. And I think Nancy Reagan, it sounds like, was very helpful in terms of talking to her husband and helping move him along where he could acknowledge the seriousness of the problem and the humanity of the problem. Did you have any interaction with President Reagan during those years?
Oh, yes, I did. Absolutely. I mean, I had the privilege of dealing with and advising 7 presidents, starting with Reagan and then culminating in my last couple of years as being the chief medical advisor to President Joe Biden. My initial interaction with President Reagan was one of discussing with him why I thought we should be more vocal and visible about HIV/AIDS. One of the problems that I believe you alluded to was that President Reagan was elected in 1980, inaugurated in 1981, January. The first cases of what turned out to be HIV/AIDS were noticed in the summer of 1981, namely 6 or 7 months into his presidency. Yet, President Reagan, as good a person as he was, did not publicly mention the word AIDS until the second year of his second term. So I believe that he missed an opportunity to use the bully pulpit of the presidency to call attention to this emerging plague, mostly among gay men and injection drug users. You know, it was only his relationship with Elizabeth Taylor, who was a very good friend of President Reagan and Nancy Reagan, that he finally did publicly say this is a real problem that we have to pay attention to. But we all wish he would have done that sooner than his second term.
The next president, of course, was President George H.W. Bush, Bush 41. And you've had some very kind words, things to say in your book about him. Tell me about your relationship with him and as it related to healthcare policy.
Yeah, George H.W. Bush is, in my mind, I've, only lived through a limited number of presidents, and I've had the opportunity to advise 7 of them. But he was truly a great gentleman. You could agree or disagree with his political ideology, but he was a man of a high degree of integrity and sincerity. I got to know him very well. From the time he was vice president, I showed him around the NIH and tried to get him, and I was successful in doing it, getting him quite interested in HIV. And when he became president, he fulfilled his promise and came back to the NIH and had me show him around in detail. And from that time on, the resources for HIV/AIDS at the NIH dramatically increased.
He was followed by President William Jefferson Clinton, who was president for 8 years. Now, it wasn't just HIV during that time. Of course, 1996, the first highly active medications against AIDS came on to effect 2 weeks after I finished my residency. But but there were other big healthcare challenges, infectious disease challenges during Clinton's term. What were some of the crises that you faced in those years?
Well, we had West Nile virus, we had the threat of bird flu, um, uh, and the thing about Clinton that was really very good is that he really opened up the ease of dialogue among uh, what we call special populations, like the LGBT community, for the first time, uh, was really embraced by the members of the White House staff, so that their special needs and the special needs of people at risk for HIV were met a much more sympathetic um, audience during Clinton's presidency. Um, Also, as I mentioned in the memoir, uh, when I visited him in the Oval Office to talk to him about some of the recent scientific advances in HIV, he asked me a very interesting question. He said, it's now 1996, and we don't have an HIV vaccine. And you told me that HIV was discovered in 1983. Why don't we have a vaccine? And I said, well, I think we need to do better in synergizing different disciplines to work together as opposed to a siloed approach towards research. We needed to get epidemiologists, virologists, immunologists, vaccinologists, structural biologists working together in a group. And he said, well, how would we do that? And I said, why don't we think about establishing a vaccine research center at NIH? And to his great credit, President Clinton said, well, let me think about it. And 5 months later, as he was getting ready to give the commencement address at Morehouse College, at Morgan State, excuse me, he said, I know we're going to set up a vaccine research center. So I need some information about what it would look like. So we gave it to him. And sure enough, within a very short period of time, the Vaccine Research Center was built on the NIH campus. The reason I bring that up to you, Dr. Myers, is because the researchers in that center, although we still don't have a vaccine for HIV, have worked on a number of successful vaccines for other diseases, including respiratory syncytial virus and Zika and others. But importantly, they were the ones that developed the highly immunogenic immunogen that was used in the mRNA platform to develop a successful COVID vaccine. So even though we started the Vaccine Research Center directed at developing an HIV vaccine, 2 decades later, it played a major role in a successful COVID vaccine, which has resulted in saving millions of lives throughout the world.
And I think you bring up a very important point about science, that often one development, one discovery can lead to a whole host of other discoveries, and that it's a process, not a single data point in time. But after Clinton comes President George W. Bush, again for an 8-year term, and he ended up being extraordinarily impactful, particularly when it came to HIV and some of the other major diseases. Do you want to talk about what your relationship was like with him?
Yeah, again, I think it goes to show you that presidential leadership, whether you're a Republican or a Democrat, if it's directed towards the broader good of humanity, it doesn't matter what your political party is. So George W. Bush was a conservative Republican president. But he had a very special place in his heart for the suffering of people that perhaps he could do something about. So let me briefly tell you about it, because by the time he became president in 2001, drugs for HIV had arrived in full force, and people who had access to these drugs went from an almost certain death sentence to being able to live essentially a normal life. If you happen to live in a developed country that had access to these new drugs, like the United States, Canada, Australia, the European Union, the UK. However, 60% of all the HIV infections in the world occur in Southern Africa. And for the most part, Southern Africans, even in the year 2000, 2001, 2002, had no access to antiviral drugs that was saving the lives of people in the developed world. So the physicians and healthcare providers in Southern Africa were very similar to me in 1981, 2, 3, when I had no drugs and all my patients were dying. Now, in the year 2000, 2001, 2002, my African colleagues were seeing people with HIV, but they were all dying because they didn't have any access to drugs that actually did exist in the developed world. So I became very disturbed and pained by the disparity in access to drugs. And there wasn't anything individually I could do about it. But fortunately, President George W. Bush felt the same way I did. And he called me to the White House and said, in these almost exact words, the people in Africa are suffering from a treatable and preventable disease merely because they happen to have been born in a certain place. And I feel, I being President Bush, I feel we have a moral obligation not to have people suffer and die from a treatable and preventable disease merely because of where they happen to be born. So we said, go back to Southern Africa and figure out if we can do a program there that would be transformative and accountable, namely to try and get treatment and prevention for HIV. So I did. I went back and I determined that it was a feasible thing so long as we put the resources in. So I came back to the White House and I argued this to President Bush, and he said, okay, go ahead and put together a program. That was 2002. And for the next several months, I worked with the White House staff and some of my colleagues to put together a program that would be aimed at treating 2 million people, mostly in Southern Africa, 15 countries, that would prevent 7 million infections and care for 10 million people, including AIDS orphans. But I told the president that would cost a lot of money. And he said, let me worry about the money, just put the program together. And we did. And we put it together for $15 billion over 5 years, aimed at the initial goal of treating 2 million people and preventing 7 million infections. To his everlasting credit, he announced the program in the State of the Union address in January 28th of 2003. And now, more than 20 years later, that program is present in not 15 countries, but 50 countries, and not 15 billion, but over $100 billion, and has been responsible for saving the lives of over 25 million people. That is a very, very compelling example of what presidential leadership can result in.
Thank you for that, recounting all of that. And it goes on. Of course, it's now under some threat from as we cut back on foreign aid, but we'll talk about that in a few minutes. The next president was Barack Obama, and you went through a number of health crises with him in the Situation Room. One of the scariest really was Ebola virus. And certainly scary, frightening for the people in Africa where it's mostly centered, but a few patients came to the NIH Clinical Center and you were directly involved with their care. And there have been subsequently recurrences of Ebola. What was that like during that time? And what was it like working with Barack Obama?
Well, it was a great pleasure working with President Obama. He was, a very, very keen intellect, very analytical in his thinking, a very calm, measured person under crises. And as you alluded to, Dr. Morris, he during his presidency, we had the swine flu pandemic of 2009, we had Zika, and we had Ebola. And, he would sometimes say semi-facetiously, I got so many things on my plate here, and now we have all of these brand new diseases that we need to worry about. But he responded very appropriately to them. It was a great pleasure working with him. Ebola, as you alluded to, was a very special situation for me because at the NIH, we were one of the 3 designated centers to take care of people with Ebola in an intensive care setting. And I had the opportunity to personally, with my team, not alone certainly, to take care of 2 persons with Ebola. One was the nurse from Texas who got infected when she took care of a person from Liberia who came over to visit his partner in Dallas and wound up infecting 2 nurses. But another patient who was part of Paul Farmer's group, who is desperately ill, who I had the experience over a 3-week period of taking with the team personally care of him, deathly ill person who recovered completely from Ebola. One of the issues with Ebola is there was this understandable but really inexplicable situation where people were afraid we were going to have a big outbreak of Ebola in the United States, and we had to do a lot of education of the public that Ebola is not the kind of disease that readily spreads throughout the population as long as you don't directly take care of a person with Ebola, which was risky for us who were taking care of the person in an intensive care unit, but not for the general population. So we had to make clear to the public, which we did, that our taking care of persons with Ebola in the United States was not a threat to the health of the country.
Well, President Obama did, before he left office, I believe he was the president that gave you the Presidential Medal of Freedom.
No, it was Bush.
Was it Bush? Okay. But as he said goodbye to you, President Obama said, and I quote from your book, Tony and I were just fondly reminiscing about the days of SARS and H1N1 and pandemic flu. So that's an example of his dry wit, I suppose.
Well, no, actually, he said something else. He said, we were just reminiscing of all that. He says, is that what you guys do for fun?
So we can't finish this little exercise in history without talking about the past and President Trump, who you worked closely with in the first administration, where you became really his front person as COVID developed. And obviously that is that's still with us, still ongoing. Can you talk a little bit about what that was like as COVID, here it was again, you've been through the wars with HIV/AIDS, and now here's this other devastating disease that's going through the population perhaps even faster than HIV/AIDS did. What was it like at the beginning and how did it develop?
Well, it was fine in the beginning, but it turned out to be, unfortunately, I wouldn't say confrontational, but some disagreements. In the very early months of COVID, I was part of the COVID response team the task force that was led by Dr. Debbie Birx was the physician who led it, but it was really led by Vice President Pence, first by Alex Azar, but then Vice President Pence took over. And as the cases accelerated in January and February, it became clear that we needed to put a pause and slow things down to flatten that curve. We were getting, thousands of deaths per day. You might remember, Dr. Meyers, you probably experienced it yourself, that there were freezer trucks parked out of big hospitals because the morgues didn't have enough slots for the dead bodies. It was really a catastrophe. So we needed to slow things down. And we put together a program to flatten the curve for 15 days and then extended it for 30 days. President Trump went along with that, to his credit. He did. But then, as he saw that the outbreak was not disappearing, I believe he became very anxious because we were in an election year. And he started to say things that were just not true, like the virus is going to disappear like magic when the weather gets warm. And when that became clear that wasn't going to happen, he started to listen to people who were telling him things that were not true, like hydroxychloroquine is the new treatment to end COVID, or ivermectin is a treatment that will end COVID. So I was put in the unfortunate position, which I did not relish, because I have a great deal of respect for the office of the presidency of the United States, that when the reporters asked me, is that true? Is it going to disappear like magic? I had to say no. And I was disagreeing with the president of the United States, which made me very uncomfortable.
I'll quote you. You said, I took no pleasure in contradicting the President of the United States. I have always had a great deal of respect for the office of the President, and to publicly disagree with the President was unnerving at best and painful at worst, but it needed to be done.
It did, because my primary responsibility was to the people of the United States, not to any political party, not to any president, but to the people of the United States. And as a physician, a scientist, and a public health official, I felt in order to preserve my own integrity, as well as my responsibility to the public of the United States, I had to tell the truth. And the truth was that these drugs were not the panacea, and the virus was not going to disappear like magic. Now, unfortunately, that created a significant backlash against me on the part of the people surrounding the president. Unfortunately, that has lasted until the present day. But, if I had to do it over again, I would have no choice. I had to tell the truth to the American public.
There is I don't think it's underestimate to say a crisis in public health now in terms of what people believe and who they listen to. How are we going to move forward from this?
That's a very good question, Dr. Meyers. It is not going to be easy, because the amount of misinformation and disinformation that is spread and amplified by social media has gotten to the point where we're almost living in an era of the normalization of untruths. There's so much untruth going around that persons, the normal man and woman in the street, who have many other things on their mind, don't know who to believe, particularly when some of the disinformation is coming from officials in the government. That is really disturbing. And the only way we're going to get out of that is to try and spread in an appropriate way evidence-based, data-based information that people who are critical thinkers will be able to independently evaluate. Because we're fighting against a sea of disinformation and misinformation.
Yeah, my own feeling is that in these presidential debates, we expect the presidents to be, or candidates to have some basic knowledge of economics and foreign policy, et cetera. And it would be nice if the candidates had some basic knowledge of science. And obviously they don't need to have a high level, but a basic knowledge of how science works. But maybe that's wishful thinking. You told me before we started today offline that you are still going back and working in the hospital. You were there this morning on clinical rounds. Another quote from your book. You had said, quote, "I have what I refer to as a non-pathological form of obsessive compulsive behavior when it comes to making sure that every aspect of my patient's care is attended to." Now, I do have to ask you, and I can only put myself in the position of a young medical student or even a resident, if you were on rounds, if it might be a bit intimidating. How do they feel at your hospital now?
Well, I think for the first month or two, it was. But now that they know that I'm a pretty good guy, and I'm not trying to embarrass anybody, I'm just trying to help them learn, I think they're much more comfortable with me now.
Well, I think it's much appreciated. Now, I'm going to finish today with two less serious questions. First is reading your book. I know that you were actually a very good athlete. In high school, you were the starting point guard in your varsity basketball team, but that your first love was baseball and that you had a fantasy of being the shortstop for the New York Yankees. Now, you've had a lot of political curveballs thrown your way, but I'd have to ask you, and when you were actually playing baseball, were you able to hit the curveball?
You know, I got to tell you, I was a much better fastball hitter than a curveball hitter.
So I think it's to everyone's gratitude that you went into medicine. I think it served our country and the world well, and it gave that nice young man, Derek Jeter, a chance to establish his career there. Finally, toward the end of the book, you use that wonderful New York phrase, "forget about it," which can mean so many different things. Now, I know that there are a lot of people in our country who are just anxious now and frightened at what's happening. To sign us off today, reaching back for your very best Brooklynese, can you tell us to forget about it?
Forget about it.
Forget about it. I want to thank Dr. Anthony Fauci. In all seriousness, this is the greatest honor to have you here on our show, to thank you for all of that you've done and continue to do for our country and for the world. So thank you for being here.
Thank you very much, Dr. Meyers. It's a great pleasure to be with you. Thank you for having me.
And please join us on the next episode of Meet the Author.